I did medical school at West Virginia School of Osteopathic Medicine, which is a small town in Lewisburg, West Virginia. And then I did not travel very far to do my general surgery. It was at Trillion Clinic, Virginia Tech School of Medicine in Roanoke, Virginia. And then I finished out cardiothoracic surgery at Wake Forest Baptist Health, and I've been on faculty at Wake Forest Baptist over the last 2 years. You can go to the next slide. Some of my interest, one being minimally invasive lung surgery. The most common lung surgery that we do is surgery for lung cancer. Also have an interest in doing minimally invasive heart surgery, and some other things I like to do outside of the hospital is mountain biking, running, fishing, and camping. So this slide, when we talk about minimally invasive surgery, this just goes and demonstrates what the Da Vinci robotic surgical system is. On the left side, you can see the surgeon sitting at a console, and you're looking into high-definition 3D lenses. In the middle picture, you will see the robotic arms, and under the blue drape, that is supposed to be a patient. And the surgeon on the left side of the console will control the robotic arms, and it gives them more precision. On the far right side is just the computer module that controls the robotic system. You can go to the next slide. So we'll be talking about lung cancer today. Lung cancer is the second most common cancer in men and women. The most common cancer in men is actually prostate, and the most common cancer in women is breast cancer. However, lung cancer is the leading cause of death between all of the cancers. The unfortunate thing about lung cancer is we do not develop symptoms until it's an advanced stage. So once the person goes to the hospital with symptoms, it's almost always too late to intervene surgically. The two main types of lung cancer are small cell and non-small cell lung cancer. Non-small cell lung cancer is by far the most common type. The two subtypes of non-small cell cancer are adenocarcinoma and squamous cell carcinoma. Adenocarcinoma overall is the most common type of lung cancer. By far, the main cause of lung cancer is smoking. Over 90% of lung cancers are caused by smoking. It's also been shown that secondhand smoke can cause lung cancer. Radon gas, which is found in the home, can cause lung cancer. Asbestosis and other workplace hazards can also cause it. Air pollution, and it's also been tied to a family history of lung cancer. Two things that are really unknown whether they cause lung cancer that we may have heard is marijuana and e-cigarettes. There is some data to suggest that it could cause lung cancer. However, the data is just insufficient to really say one way or the other whether it does or not. So prevention, since most of lung cancer is found at advanced stages, the best thing that we can do is to prevent it to begin with. So of course, smoking or smoking cessation, quitting smoking and avoiding secondhand smoke is by far the most important. You want to avoid radon exposure, and if anyone's ever purchased a house before, you know that they do test the houses for radon gas. Avoid occupational exposures if at all possible, and as always, practice a healthy diet and exercise. So as I mentioned, with lung cancer being diagnosed most commonly in the advanced stages, over the last 5 to 10 years, we've tried to come up with the best way to find these before it's too late. Within the last several years, lung cancer screening has been popularized. Lung cancer screening is a CT scan that only takes several seconds to do. It's a low dose, so you don't get significant radiation exposure, and it looks for cancers before they start. If we can find the cancer before the symptoms start, then we can diagnose it at a stage where it's treatable. One unfortunate thing about lung cancer screening, or sometimes it's fortunate, that we do diagnose many other things besides lung cancer, and there are nodules that are not cancerous. So anytime that we have a discussion about lung cancer, we have to really discuss the pros and cons of obtaining a CT scan of the chest. And as always, lung cancer screening is not a supplement for stopping smoking altogether. So to qualify for lung cancer screening, you have to be of the age of 55 to 74. They are trying to expand the age group all the way to 80 for patients that qualify. You have to be a current smoker or have quit smoking within the last 15 years, and you have to have a 30-pack year smoking history. And to calculate your pack year, you have to multiply how many packs of cigarettes that you smoke a day by the years that you have smoked. So if you have smoked only for 15 years, but you have smoked 2 packs a day, then that's equal to 30 pack years, or 1 pack a day for 30 years. And if you meet all 3 of these criteria, then your insurance should approve you for lung cancer screening. The treatment for lung cancer, and I want to emphasize on the first bullet point, is surgery. As long as we find this at an early stage. And one of the main ways we have found cancer at an early stage is, again, lung cancer screening. If we find the lung cancer at an early stage, surgical cure may be possible, and you may not need chemotherapy or radiation. Now, if we found that the lung cancer has spread into the lymph nodes, or if it's spread into the chest or ribs itself, then we may suggest chemotherapy or radiation. And there's also many genetic or immunotherapies on the market today that have become popular within the last 5 years. But again, I want to emphasize that if we catch it early enough, it's curable with surgery alone. And just for the last couple slides, over the last year, we all know about COVID-19. Some patients are very hesitant to come into the hospital over the last year. We've seen numbers of patients not getting colonoscopies, not getting the mammographies, and again, not getting lung cancer screening. They're staying away from the hospitals because of a fear of catching the COVID-19 virus. I just wanted to put your minds at ease that the hospitals are safe. And to not delay any care and pass this on to your family members and loved ones. We have been operating through the whole COVID epidemic and have not had any problems. The hospital's taken special precautions, such as mandatory mask and temperature checks at the front door. They're increasing their sanitation of all the surfaces. Anytime we operate on a patient in the hospital, they do receive a COVID-19 test to make sure that we're not bringing any COVID-19 positive patients into the hospital. You are allowed visitors. There's a lot of misconceptions that you have to come into the hospital and no family can come along with you. This is not true. Early on within the COVID pandemic, they were limiting, but however, you can bring visitors now. And what the hospital is doing is placing the COVID patients on different floors, and they're in isolation rooms, so nobody will get exposed. So again, the hospitals are safe. Please don't delay care. If anybody does qualify for lung cancer screening, that is the best thing that we can do if you do have lung cancer, to find it at a very treatable stage. And I encourage everyone to do so if they qualify. And this is the end of my brief presentation, but just so you know, and so I have some resources, this is the website found on the Wake Forest Health, the website where you can apply for the low-dose lung cancer screening. We have a lung cancer screening number that you see there that you can call, and they can get you set up for lung cancer screening. We also have a smoking cessation clinic at Wake Forest Baptist Health, with the number being on the third line there, that you can call and get some resources to help you quit smoking. And also your family physician. It's not just this number and a thoracic surgeon that can qualify for you for lung cancer screening. If you have a family physician, the family physician can also perform your lung cancer screening and refer to a thoracic surgeon if they found a concerning nodule or they have a question. So with that, it was just a brief introduction to lung cancer awareness and prevention, and I'm open should there be any questions.